Hello, and how are you? Welcome to today's class where we're going to focus on healthcare planning. My name is Winnie Parawam, and if you're new here, this is Medic Academy, a channel where we focus on lectures and lessons pertaining to healthcare or health units and courses. So, welcome again and be with me till the end. So if you're a healthcare worker, you might have been in one moment sitting in a management committee where you have to plan for different activities or to plan and come up action plans that will help us implement or make sure that our activities in the different levels of facilities are being implemented. So as we start this, we need to appreciate that planning can happen at a different level. Could be maybe at facility level, it could be at institutional level, and sometimes could be at bigger platforms like parastatals or organizational levels. So welcome and let's enjoy. So regardless of whichever level of healthcare planning and management that you're practicing, we need to appreciate that you first have to know what are the basic concepts that we need to understand as it comes to healthcare planning. So the first basic concept we need to know is what is a plan. So a plan in reference is a statement of future activities and a prediction of effects that will have on the present situation. So a plan being a statement means it comes as the final product that we get after we have successfully done our due process of planning. So it's a statement that will include activities or thoughts or ideas that you are thinking should be implemented to have a specific outcome or effect, be it in the present situation or also in the future activities that you're looking at. And from the word plan, then we end up with the word planning. So as opposed to plan, which is a document or a statement that outlines our activities and prediction of effects, planning on its own is simply a process that is identified as very systematic. So planning is a systematic process of identifying and specifying desirable future goals, and that will be outlining also the appropriate causes of action of what should be done. So planning is very systematic. It's not like a plan, which is a document that shows what you're planning to do. Planning on its own is just a process, a systematic process that helps in identifying and specifying the future goals and outlining appropriate course of action. That is, what do you plan to do or what are you intending to do? And once that is successfully done, the second level is determining the resources required to achieve them. So planning being a process will identify the goals, come up with course of action or rather what is to be done, and then determining the resources that you will need to achieve this particular plan. So in rather, you can now get the difference that a plan is a document or a statement, while planning is the process that will future on. Moving forward, we need to appreciate that the word plan and planning are general described. They don't specify where we are going to plan on. But now with what we are doing, because we are healthcare workers, our bigger focus is in the health. So when you're a planner and you're in the healthcare, then you'll be participating in what you call the healthcare planning. So what is the healthcare planning? What is healthcare planning? This now is the process of defining community health problems, identifying needs and resources, establishing priority goals, and setting out the action that needs or to reach these goals. So with healthcare planning, we are looking at the focus of community health problems, identifying needs and resources, and then setting up goals and coming up with an action that you're planning to reach these goals. So let's say our goal is to reduce maternal mortality rate, for example. The health plan in this case, we look at this problem of mortality rates and then come up with what is needed and which resources do we need for us to establish the goals and the setting of what to do. So that's what health planning looks at. So mostly with health planning, we will take into account available resources and the available means and method in our healthcare. thus, having understood the concepts of health planning, where we started with the plan and say this is the final output after we've gone through planning, and then looked at the general definition of planning, and now health planning itself, why is it so important that we need to do planning or effective health planning? Number one, effective health planning ensures that we are able to adapt to current trends and acknowledging that currently there is developments in terms of artificial intelligence in our delivery of healthcare services. There's input of development in terms of new diagnostic trends and tools that are now being innovated and discovered. We are finding new pharmacokinetics and drugs that are coming in to help us treat with so many commodities that are also coming up. So understanding proper planning, then we are able to get to understand these current trends and input them in our plan. The other part is proper planning helps us communicate goals and objectives, especially for what the committee or the institution is planning to do. So when you bring goals and objectives, you ensure that everyone is able to be brought to the same page and they can all be focused for the purpose of the same vision for the organization. The other part is with communicated goals and objectives, then we are able to review and clearly define the purpose and objectives. And with this, it's not good to assume everyone understands where we are headed in terms of a vision of an organization or an institution, but it's good that through planning, you can always reevaluate and review in terms of what is the purpose and how are we going to achieve all this. And when everybody has clearly understood the defined goals and objectives, then that builds commitment and a sense of belonging. So everybody ends up owning up the objectives and owning up the goals that the team is planning to implement. So with all this, you've come up with a good plan. There's effective use of resources. And with effective use of resources, this means we are able to weigh down on the priority areas that will need more resource allocation. So for example, based on the specialties that you have, based on the services that the team is providing or the healthcare system is providing, then you can look at how effectively do we allocate so that we prevent over allocation or under allocation of these resources. And also this creates a basis of monitoring and evaluation in terms of progress, so you can see and say, let's say, what are the indicators that needed to be achieved and was the plan able to do that. So you can come back and check from the previous plan what went missing or what was not implemented and how best can we bring change. Do we readjust or do we take it up as it is and elongate the period of implementation? What exactly will you want to do, having been able to check? And this can all be guided by the planning document or the healthcare plan that was developed by the team. So there's so many importance of healthcare planning, but these are just a few that could guide us. So the importance of healthcare planning is diverse. But now the work comes in, which approach can you use to come up with a good health plan? So the approaches also are quite many, but I would like us to start with the first one where we talk about the bottom-up planning approach. So with the bottom-up planning approach, this is an approach whereby a plan is developed at the lowest level of healthcare. So this plan mostly are generated from the lowest level of healthcare cadre. Based on where you are in your system, you find cadres that have like tier 1, tier 2, tier 3, tier 4, the way to the highest. And from the lowest, then this contribution or inputs are now channeled next level until the highest level of authority who have the roles or the authority to approve the final plan for implementation. So the bottom-up approach appreciates that the plan needs to originate from the lowest level of healthcare provision, move up all the way to the highest level of authority, who will now stamp up and bring the final documents that will be implemented. So mostly in most healthcare systems, the lowest level of healthcare is the community. So mostly here they can conduct like community dialogues or community meetings and welcome inputs from community members in regards to how they wish the healthcare system will best operate. And then the second approach is the top-down approach. And in the top-down approach, the healthcare planning approach here administers a way in which the plan is developed by the highest level of authority and the final decision is channeled to the lower level of implementation. So most of the time you find maybe it's a board of directors that wish to bring in a new way of management or a change in a policy or new rules and regulations, then that decision is made in final at the top management, and then the decision is channeled down to the healthcare workers or implementers of these particular decisions. So unfortunately with the top-down planning is the lower levels and most of the time are not consulted and they're just mostly involved in the implementation category. They're given the final product to input without really considering their inputs. That's the unfortunate part of top-down planning. Then following up is we have the mixture of top-down and bottom-up planning. So the mixture of top-down and bottom-up planning is that it allows participation of all. So it appreciates that there's be input from the top management and there'll be input from the lower cadres. So there's the top-down where they now we have the top leadership or top authority bringing in their account, bringing in the expertise, knowledge, and issues around management. And then you will have the bottom side, which is now pulling in their participation, thoughts, perceptives, ideas, and a general view of what they feel the policy or the plan might have on them. So it's a good one because here it considers both participants or it considers both stakeholders that will be affected by the health plan that will come as a result. The other approach is on the need-based planning. And on the need-based planning, it says that the document or the plan is based on the needs of the community or the needs of the public. Now, as healthcare managers or planners, you need to know that whatever we develop, the end consumer is the community or the public because these are the ones who get sick and they visit the facilities or the institutions for service access. So the planning is done mostly putting in mind what are the needs of this particular community. So for example, if there is a need, let's say there's increase in maternal mortalities, then in this case, the need for maternal mortality reduction will perpetrate or will lead to, a conviction to develop, let's say, a prevention strategy for maternal death or an approach to reducing maternal death due to the given cause at that particular time. Unfortunately, the need-based planning does not take into account whether resources are available or not. MASO is done more in an emergency setup where you need quick interventions, and so the plan comes in first and then resources are sought for after. And the last one is the resource-based planning, whereby in resource-based planning, we are saying we plan based on the resources available. So if you sit in the budgeting meetings, you are therefore able to see what is our healthcare team having in terms of availability of resources. What is the amount of money allocated? What are the facility availability? What is the human resource? What is the financial capital of this particular project that you are looking at? So based on the resources, then the team can sit down and plan in regards to the needs of the particular population that you are looking at. So the resource based is mostly guided by the budget and it's guided by the variety of resources existence. So the resource envelope is communicated before the beginning of the planning process. So you plan, but your main guiding point is the available resources for this particular population. Unlike the need-based planning, where we are planning for the community, yes, but we have, or rather we don't have knowledge in regards to how much resources is available or is needed for this particular need. So at least we've talked of the five. So we've had the bottom-up planning, top-down planning, need-based planning, and the resource-based planning approaches in regards to health planning. And so to sum this up, we need also to appreciate that a healthcare planning team is made up of different specialties of contributors. And the players in this team come from different categories. based on what you're dealing with. So if it may be a disaster management planning team, or maybe it's a maternal death planning team, or if it's a child care provision team, it will vary based on the team you're talking about, and this will be based on the specialties. Just like in a hospital, we have different departments. So the healthcare planning will vary based on where you're working and the roles you're playing. So you need to appreciate that in the healthcare planning team, we understand that the technicalities will vary based on the situation being looked at. So we have the first category of players, and this is made of the technical representatives. These are a group of people that have the know-how or adequate specialty knowledge in regards to the topic at hand or to the need at hand. If you're looking at nutrition needs or nutrition-based needs, I believe in such a team you will need nutritionists who have experience in such an area. You will need policymakers that understand nutrition, policies in your country or in your organization. You will need players in the healthcare system that understand the nitty-gritties and the specialized skills and knowledge that is pertaining to that particular need that you want to solve as a team. Then we have the healthcare or the health management team members. So in the different arenas, there are different team members. If it's a occupational health team, it's a bit different. If it's a planning team, it's quite different. So the management team, again, members will change or will be evaluated based on the care that you want to provide or the need that you want to take care of. So the healthcare management team also varies. There are common cadres though in our healthcare facilities. For example, the issue of medical team like doctors, nurses, occupational therapist, physiotherapist, and all that. But also you may find in some cases you need human resource managers, you need the accountants, you need the politician. These are all members that can form a team. But now, like I'm saying, it will depend on the need that you want to solve. And then the last category that you need to include is the internal and external stakeholders. So by definition, stakeholders are individuals, community, group, or organization who have an interest when it comes to the outcome of a program. So if you're a healthcare team member or a healthcare planner, you're coming up with all these plans that will be implemented in the community, and it will affect different group of people. So the people or the community or whichever particular person it is, provided they might have an interest or they might be affected by the particular plan or activities, then this person can become a stakeholder. And now the stakeholders can be internal, they can be external. Internal means they're directly part of the organization or they're directly part of that particular institution. While external means these are outsiders who are not directly working in your program or in your institution, but they'll be affected. And most of the time here, they come in as public participants or community-based organization and such. So the key players will based on what you're looking at, and it will vary from the different composition of the teams. So now let's look at a few examples of the stakeholders that you can have in healthcare planning. So like I said, we define that a stakeholder could be an individual, a community member, or an organization that has an effect or will be affected by the outcome of the plan that you'll come up with, be it in form of activities or be it in form of the general policies that we may develop. So there are people though that as much as we are developing all these plans, we need to always remember and include them when it comes to the healthcare planning. And most of the time we include them through the stakeholder participation or stakeholder discussions or stakeholder forums. And one of them could be politicians. So now politicians are people who work around in our legislatures and they develop rules and regulations to guide and even lead our healthcare policies. So politicians mostly play a key role when it comes to coming up with a healthcare plan. Then we have economists. These are people who understand the rules of rules of supply and demand. We have financials who will help with the financial aspect and resource mobilizations. We have donors. Remember, some projects really don't mean to like financed by the government. Sometimes you can have donors who can just fund it up. We have civil society organizations or institutions. We can have consumers of these services. That could be individuals, women health groups, or women health support systems. There's faith-based organization like churches, mosques. There's health training institutions. If maybe you are introducing a new guideline in terms of management of different diseases, you will want this to be trained in the coming healthcare workers, and this has to be included in the curriculums or in the methods of trainings and models that are existing in the various countries. So these are the stakeholders, they're just examples, but you can always have more. Like again, I've said, based on the need that you want to solve in your particular institutions or community. So thank you for staying with me to the end. And this is Medic Academy. My name is Winnie Barawa. If you are new, remember to comment on our work. You can subscribe and also can share these lessons with other people who may be beneficial, which might be beneficial to them. And remember to come back. We keep posting frequently. And thank you for staying to the end. Bye bye and see you in our next lesson.